A stronger place today as a nation with more tools to protect ourselves and our communities from COVID-19.
Tonight, the CDC says millions of Americans no longer need to wear a face mask indoors. The agency is changing its standards to determine whether face coverings are recommended inside. And now, under the new standards, almost 70% of the country lives in a county considered low or medium risk where masks are no longer necessary. But even with relaxed standards, the CDC says San Antonio residents should still consider masking up. KENS 5 reporter Matt Houston explains why.
Ready?
I think it's been needed for a while.
Or not.
I think it's important when we're in a certain amount of feet of each other to keep them on.
Doctors say the CDC today took a first step toward treating COVID-19 as if it'll be around forever. Now, the agency will weigh hospital conditions over raw case count when it considers whether masks are necessary in a given county.
It's a step in the right direction because it's really, I think, based on the kinds of evidence that we've seen to be most reliable.
But to the CDC, San Antonio is still in code red and not ready to unmask. With just a few more days of improving numbers, the city will move to code yellow, when the agency says you should ask your doctor what's best for you. In code green, that conversation is not necessary. You're free to lose the mask.
We can feel better and better, I think, as we progress through this pandemic.
In the last 30 days, almost 1,000 patients have checked out of San Antonio hospitals. Case count is way down too, so much so that Metro Health will close its Alamodome testing site on Monday evening.
And Matt joins us live now from the medical center. So Matt, how close is San Antonio to moving into what's known as code yellow?
Yeah, Phil, the fastest way to do so is to cut the active infections per 100,000 residents from 208 to 200. We're very close, right? If you really simplify the algebra here, this is doable within the next week or so. In Medical Center, I'm Matt Houston, KENS 5.